I'm Dr. Cecil Bennett. The annual wellness visit was created as a part of the Affordable Care Act and started in 2011. The purpose of the AWV is to identify risk factors that may be hidden and educate patients on their health status and steps they can take to maintain or improve their health. The visit is an assessment of risk with an educational component, not a physical examination. That is very important to remember. The vast majority of the AWV can be done by the patient and a medical assistant, not necessarily a provider. That is also very important to understand. As providers, we understand as our patients get older, there is both a cognitive and physical functional decline. For some, the functional decline slope is gradual, for others, steeper. Preventive services intervention early in the Medicare process can alter the decline in a positive manner, thereby stabilizing a patient's quality of life as they get older. Simply ensuring that all our seniors get annual flu vaccines or appropriate pneumonia and shingles vaccines can positively affect their quality of life as they get older. Documenting nutrition, hearing, and vision status are also very important to maintain good health in all our seniors. I keep saying the word all, not some of our seniors, because the goal is to have all these preventable services done on all our seniors, not some. For most primary care providers, before the AWV existed, we struggled with ensuring that we were completing all these preventive services with our seniors. We may have done some of these preventive assessments on some of our patients, but not all of them, and sometimes we're confused as to what patients we did them on and which assessments. The annual wellness visit is a tool that helps us to create an organized preventive file on all our seniors. The reimbursement for this new Medicare tool is $180 for initial visit, and repeat Medicare annual wellness visits reimbursement is $120. Now that we have this reimbursable resource, why are only 20 to 25% of providers using this tool after 7 years? There are several reasons. Some providers do not understand the program and don't know what to do. Some providers treat the AWV like a physical examination that takes up their time. Some struggle with scheduling patients or checking eligibility. Some try to do the annual wellness visit in their EMR, but the software is just too cumbersome. Some stay away from the AWV for fear that not completing it properly may subject them to Medicare fraud or some type of payment clawback. The safe thing to do when it comes to the annual wellness visit for many of us is just not to do them at all. We'll just continue to capture what data we can via our regular office visit and forego the $180 or $120 reimbursement. That's safe. Well, we don't have to think that way anymore. There is a simple, easy-to-use web-based tool to complete annual wellness exams on all our patients. That's right, all our Medicare patients. The tool is named THEO, T-H-E-O, and is thorough, includes all the required Medicare assessments, safe, guaranteed to pass any Medicare audit, efficient, will verify which patients qualify for the annual wellness visit, time sensitive, requires very little medical staff or provider time, financially consistent, you will get paid for the extra exam and the recommended preventive services. Here is how THEO works. When a Medicare patient signs in for a scheduled regular office visit, the front office person hands them a tablet and tells the patient, please answer the questions on this tablet to complete your Medicare annual wellness visit. Medicare allows you to have a personal health assessment visit annually to educate you on your preventable health needs. The screening is covered 100% by Medicare. Just tap the screen to get started. When a front office person gets the tablet back, they hand THEO to the medical assistant that brings the patient back. The MA enters at this time vitals and collects a urine specimen to evaluate this senior for polypharmacy and medication compliance. This polypharmacy screening urinalysis is a unique and exclusive tool to our program that verifies objectively patient compliance with their blood pressure, diabetes, cardiac, and other essential medications. No need to line up pill bottles and guess what medications our patients are taking anymore. In a few days, you will get a printed or electronic lab report that reflects what is in our patient's system to 97% accuracy. Amazing. Here is a polypharmacy and medication compliance report. This patient was prescribed Lipitor, metformin, lisinopril, aspirin, metoprolol, and Actos. The green section indicates that the patient is compliant with their metformin and their lisinopril. The red section indicates that the patient is not compliant with Actos, metoprolol, Lipitor, and aspirin. What is interesting is that the yellow section tells us that the patient is positive for lovastatin, which means there may be a problem with the EHR or polypharmacy issue. Cotinine is also positive, which means the patient is a smoker, and ibuprofen is positive, which may be something the patient is taking over the counter. This report should be reviewed with the patient to get them back in compliance. Your MA then checks that the vitals have been entered and the urinalysis collected, which completes the annual wellness visit. A care plan is then generated and a copy given to the patient. The patient now knows, based on how he or she answered the assessment questions, what healthcare preventive services they need.
This is your annual wellness care plan.
Again, the AWV is an educational tool. When a patient sees the provider, there's a short targeted discussion about the conclusions of the AWV.
As you can see, there are some wellness issues that we're going to need to review.
The patient is told that they may need to follow up on another visit so that the preventive services indicated in the annual wellness visit can be provided, and that there may be a copay for that office visit, as with any other office visit. It's important to remember the provider sees the patient for the scheduled E&M visit. At the end of that visit, the E&M office visit will be billed. A modifier is added to account for the AWV, and the AWV is billed as well. The provider is paid for both the E&M visit and the AWV. Theo, once again, is thorough, includes all the required Medicare assessments, safe, structured to pass any Medicare audit, efficient, will verify which patients qualify for the annual wellness exam, time sensitive, requires very little medical staff or provider time, financially consistent, you will get paid for doing the annual wellness visit. We welcome the opportunity to discuss with you how Theo can improve the care of your seniors and be very financially rewarding to your practice. Let's change course and stop doing things the way we normally do them to no avail. Let's do something that's good for all our seniors, not just some. I look forward to implementing Theo in your office. My contact information follows. Thank you.